Inaccurate scoliosis measurements is one of the most common reasons for ineffective treatment. You see, when it comes to scoliosis, the size of the curve matters because the size of the curve is one of the biggest determining factors for the likelihood or the risk of the curve progressing. It's also one of the biggest factors that are considered when choosing different types of treatment. And curves are inaccurately or mismarked or measured all the time by other healthcare providers and even by major radiology centers. So if you're making decisions based off of inaccurate information, you're likely making inappropriate or less effective decisions to properly treat your child's scoliosis. Hi, I'm Dr. Chris Gubbels. I'm a leading authority in the non-surgical treatment of scoliosis and the head scoliosis clinician at ScoliCare Denver. Now, one of the things that we see in our office as we get patients from different sources is they just frequently have misinformation about the severity of their scoliosis. And a lot of times this comes because they don't really understand the size of the curve, or whoever they had previously went to didn't accurately measure their curve properly. I'll give you an example of what I mean. As we were building ScoliCare Denver, I went out and directly met a lot of different healthcare providers. And I remember one day I walked into the one provider's office and I went to introduce myself. And he immediately said, I actually have one of the most severe cases I've ever seen. He said, I want you to take a look at it. And I went back there and he showed me the x-rays, and instantly I knew this was an extreme case, that it had progressed way beyond conservative methods. And part of it was the x-ray quality. We couldn't see the whole spine, but from what I could see, I could tell it was pretty severe. And I told him, I said, this is actually a surgical case. I'm happy to take a look at it and talk to the parents, but this person's probably got beyond conservative care. What I didn't realize is the day before that, the mom had actually found our office and she had already scheduled an appointment before I even met this doctor. And when the mom came in, the story was she'd went to a few different providers. The first one was a functional medicine doctor who didn't even take x-rays and told her that she didn't really have any problems and just take some supplements and the child would be fine. So without an x-ray, you can't even properly diagnose scoliosis. So then she went to this other chiropractor. This chiropractor actually thought that he had reduced the size of the curve. And he had told the mom that when they came in, the curve was 60 degrees, but it had gotten down to like 50. But when the mom came in, I did new x-rays and reevaluated, and the curve was actually 110 degrees. It was way beyond the conservative guidelines, or the guidelines to possibly even treat this with conservative methods, and they absolutely had to have surgery. And I don't know what that curve was when they went to the first doctor, the functional medicine doctor, but if it had been caught earlier when it's smaller and got appropriate treatment, it's possible that she would have not had to have surgery. So first, when we measure scoliosis, we use something called the Cobb angle of measurement. And you need to have at least 10 degrees of lateral bending with rotation for scoliosis to be present. Now, when a curve is measured between 10 and 25 degrees, we consider that a mild scoliosis. When it's measured between 25 and 40 degrees, we consider that a moderate scoliosis. And when it's beyond 45 degrees, that's considered severe scoliosis. Now, in the traditional orthopedic world, a lot of times they don't give any recommendations for conservative treatments until the curve is between 25 and 40. So they have a really narrow window of opportunity to treat. And we know that we treat curves earlier, even before they're 25, the treatments are generally easier, less invasive, less involved, and more effective. Also, we have evidence to show that we can treat curves up to 60 degrees effectively in many cases with non-surgical treatment methods. So first of all, that's how we measure and classify different scoliosis. Now, even as a parent, you should really understand this. So let me show you how we actually measure this. So using the Cobb angle measurement, how you measure this is, one, you have to find the most tilted vertebrae at the top and the most tilted vertebrae at the bottom. So looking at this, we have found the most tilted vertebrae at the top and we drew a line with the top of the end plate. We found the most tilted vertebrae at the bottom and we drew a line with the end plate, and where those intersects, that forms an angle. And it's that angle right there is what's called the Cobb angle. So that's how we would measure the severity of the scoliosis. People a lot of times say it's this percent, it's actually degrees. We use the word degrees. This would be a 28 degree scoliosis. Now, just getting the right end plates right is huge, because if you don't pick the vertebrae right, you're going to miss accurately, or you're going to inaccurately measure the curves. Also, if you don't measure the curves accurately on the initial and subsequent x-rays, it's hard to really know if the curve is progressing or if it's actually getting worse. So let's take a look at this x-ray right here. This is an example, and if you think about this, we can look and see, like, where do we think we're going to measure this? And if we measure it here, which some providers may, we'd say, well, it's 56 degree curve. We could still treat this conservatively. If we measure it here, it's 72. So you can see, like, knowing where you measure that, and if you measure it and you're choosing the wrong vertebrae inaccurately, that can make a complete difference in what you think the severity of the curve is and in your decision making. A 72-degree curve is someone that's a candidate for surgery and they likely need surgery. At 56, they're definitely in surgical levels, but they can still explore non-surgical treatment options. So we have to make sure we're measuring the curve properly. Now, the third reason that the size is so important is the size of the curve is one of the biggest, if not the biggest, predictor of the likelihood of a curve progressing. But even small curves, if someone has a lot of growth remaining, can still progress. But if we have a larger curve when someone has a lot of growth, when they're earlier on in puberty, that's almost 100% likelihood of curve progressing. And even in the orthopedic world, curves over 30 degrees, if someone is just starting puberty growth spurts, they would say that it's 100% likelihood of it progressing to surgery. The two numbers to really pay attention to are 30 and 50. You see, even when you're done growing, a curve that's over 30 degrees has an increased likelihood of continuing to progress in adulthood. If a curve is over 50 degrees, it 100% will keep progressing in adulthood without appropriate treatments. So we also look at the size of the curve to determine the goals of non-surgical treatments. So you have to know the size of the curve and you have to feel really confident that that's actually being measured properly. But also keep in mind, there's about a 3 to 5 degree error in measurements. So if someone says you have a 38 degree curve and someone else says it's 42, it's the same thing. There's just a little bit of error in marking. With using new software and marking them digitally, that difference shouldn't be more than 3 degrees, but there may be a slight difference. Now, if you're watching this and you're wondering about your child's scoliosis and how big the curve is and how likely it is to progress and what your treatment options are, just click on the link below and request a free discovery call. And in that discovery call, we can evaluate your child's x-rays, or if it's yours, your x-rays, and we can determine the likelihood of the curve progressing, and we can actually tell you the severity of the curve. Now, one of the other questions I get asked all the time is, how likely is it we can actually reduce the size of the curve? Or can we reduce the size of my child's curve beyond just preventing it from going to surgery? Well, one of the biggest predictors or determining factors in the likelihood of a curve reducing in size is the flexibility of the spine or spinal flexibility. So click on the next video and I'll dive into that, and I'll see you there.